All right, let's talk about something that can be, well, pretty alarming to see on a lab report: pus cells. If you're trying to conceive, seeing those two words can send your stress levels right through the roof. So today, we're going to demystify that lab report, get to the bottom of what those cells are, and figure out exactly what to do about them.
So you get your semen analysis back. You're scanning down the page, and then bam, you see it, pus cells. Your mind probably starts racing, right? Is it an infection? Is this why we're having trouble? That's the big question, and that's exactly what we're going to answer today.
First things first, let's get our terms straight. When doctors find a lot of pus cells in semen, they call it pyospermia. It's really just the official medical name for it. And what it means, essentially, is that your immune system is fired up in your reproductive tract, and these white blood cells are the little soldiers it's sending to the front line.
So what's the magic number? Well, how many is too many? The official line in the sand for a pyospermia diagnosis is usually more than 1 million white blood cells per milliliter of semen. You know, a few here and there might not be a big deal, but once you cross that 1 million mark, it's a red flag that doctors are going to want to investigate.
Okay, so we know what it is, but the really crucial question is, how do these pus cells actually mess with sperm? Well, it turns out they're pretty nasty. They launch this kind of two-front attack that can really seriously impact fertility. Let's break down exactly how they do it.
So this is where the damage really happens. On one hand, these white blood cells release something called reactive oxygen species, or ROS. You can basically think of them as tiny chemical grenades that damage the precious DNA inside the sperm. And if that wasn't bad enough, on the other hand, the sperm can literally get stuck to the pus cells. It completely wrecks their ability to swim. It's a devastating double blow to both sperm quality and their ability to do their job. To treat this thing effectively, you really have to put on your detective hat. You have to ask, where are all these pus cells coming from in the first place? It's not just random. There's always an underlying cause, and finding it is the absolute key to solving the problem.
And boy, the list of potential culprits is pretty wide. It could be anything from a lingering, untreated infection like a UTI, or maybe some inflammation in the prostate. STIs are a pretty common cause too. So is a condition called a varicocele. It could even be a physical blockage or lifestyle stuff like smoking. And here's a big one that catches a lot of people by surprise: not ejaculating often enough, which means the system never really gets a chance to flush itself out.
Oh man, this scenario right here, it's so common, and it's really important to get this. Let's say you get a UTI, and the doc gives you a 10-day course of antibiotics. After 4 days, you feel 100 times better, so you figure, hey, I'm good, and you stop taking them. The problem is, the infection wasn't totally gone. It was just knocked down. It can then retreat deeper into the reproductive glands, setting up camp and becoming this stubborn, low-grade problem that's way harder to get rid of later.
So just how common is this? Well, if you look at the numbers, research shows that about 5% of men who are navigating infertility have pyospermia as a contributing factor. So while it's not the #1 cause of male infertility, it's definitely a significant piece of the puzzle for a lot of couples out there.
All right, we've talked enough about the problem. Let's shift gears and talk about the solution. Because here's the good news: pyospermia is totally treatable. We're going to walk through a really clear 3-part action plan to help you get a handle on this and take control.
Here's the game plan in a nutshell. Step 1, you have to treat the underlying source, the root cause. Step 2, you've got to get on the right medication for the job. And Step 3, there are supportive lifestyle changes you can make to help your recovery and protect your sperm. Let's dive into each one. Step 1 is the foundation for everything. You have to treat the root cause, not just chase the symptoms. This means you and your doctor need to do some digging. Is there an infection that needs targeting? Is it a varicocele that needs to be sorted out? Or maybe a blockage that needs clearing? Nailing down the origin is absolutely the first critical move. Okay, let's talk meds. Your doctor will likely prescribe some anti-inflammatories to bring down any swelling, and of course, antibiotics. Now listen up, because this is crucial. It often requires a long course of antibiotics. I'm talking 3 to 6 weeks. A short, 1-week course just might not be powerful enough to get deep into those glands and completely wipe out that stubborn infection we talked about earlier. And finally, Step 3. This is the part where you come in, the things you can do to support the medical treatment. Cutting out smoking and alcohol? Huge. Increasing how often you ejaculate actually helps to mechanically flush all those pus cells out. And adding antioxidants can give your sperm a much-needed protective shield. Let's zoom in on those antioxidants for a second. A really solid toolkit would include vitamin C to help with motility. That's how well they swim. Vitamin E helps protect the sperm's outer shell, and CoQ10 acts like a tiny battery pack to give them an energy boost.
Just remember, it takes about 3 months for new sperm to fully mature, so you'll want to take these consistently for at least that long to really see the benefits.
Okay, we've gone through the causes and the whole treatment plan, but hang on, before we wrap this up, there is one more critical piece of information, and honestly, this could completely change everything about your diagnosis and maybe even save you from unnecessary treatment.
This right here, this is the million-dollar question. You've been worrying about an infection, you've been gearing up for treatments, but what if? What if the lab report got it wrong?
And here's the wild part. Under a regular microscope, immature sperm cells look almost identical to white blood cells. I mean, they're practically twins. So a lab that isn't using a specialized test can easily mistake one for the other, leading to a totally false diagnosis of pyospermia and a whole lot of unnecessary worry and treatment.
So here's the most important thing you need to know. There is a definitive test that cuts through all the confusion. It's called the peroxidase test. It uses a special stain that reacts only with white blood cells, making them change color. This allows the lab tech to clearly and accurately tell the difference between a real pus cell and an immature sperm cell. It takes away all the guesswork.
So let's pull it all together. Here are your key takeaways. Number 1, always work with your doctor to find and treat the real root cause. If you get antibiotics, commit to the full, long course. No stopping early. Help things along by flushing the system often and protecting your sperm with those antioxidants. And maybe most importantly, if you have any doubt at all, empower yourself. Ask your doctor for a peroxidase test to get a 100% confirmed diagnosis.
Look, now that you're armed with all this knowledge, you're in a much better position to have a productive conversation with your doctor. Understanding the possibilities, the treatments, and especially the right questions to ask, well, that's the first and most powerful step you can take on this journey.